I am Dr. Jayasankar. I am the head of the Department of Orthopaedic Surgery. I am also the medical director of the hospital. The focus area of the orthopedic department is treating fractures. The hospital is very well equipped with state-of-the-art operation theatres, operating equipment and operating tools. The department is covered. The subspecialties are spine surgery, shoulder surgery, pediatric surgery, hand trauma, arthroscopic surgery and arthroscopic shoulder surgery. All these subspecialties are well taken care of with experienced consultants who are well qualified and experienced in these subspecialties, and they take care of this all patients. With this, orthopedic department is able to provide with a high quality service with the excellent outcome of the procedures with patient satisfaction.
Vanakkam, I am Dr. Prashant Kekre. I am a spine surgeon. I am associated with Sundaram Medical Foundation and Dr. Rangarajan Memorial Hospital for the last 23 years. Extremely important because spine, the primary function is keeping you erect. We are bipeds, that is, our mobility is on 2 limbs, unlike animals who are on 4 limbs. And therefore, spine plays a very, very important part in keeping you erect. Now, if this function of keeping erect is lost, the person is in big trouble. And therefore, it is very important that the posture is maintained at all points of time to prevent any future spine disorders.
My name is Dr. Vijayraj. I am a shoulder consultant with the Sundaram Medical Foundation and Rangarajan Memorial Hospital for the past 8 years. Common symptoms with which patient present in the shoulder problem is mainly pain and followed by stiffness and very rarely giving away of the shoulder. Shoulder pain and neck pain are closely related. Neck pain, patient presenting with it will complain of pain that radiates down to the elbow to the fingers, whereas shoulder pain restricts itself to the arm up to the elbow. It will never radiate below the elbows.
Greetings from SMF. My name is Dr. Amit Kumar Sharma. I am a full-time consultant at Sundaram Medical Foundation, and I am a general trauma surgeon. I do trauma surgery as well as arthroplasty and arthroscopy. Some of the commonest injuries that we see, again, it depends on which age group we see in. Children often have a tendency to fall on their outstretched hand, and they often sustain elbow injuries very, very commonly. These can be something as simple as a small nursemaid's elbow, which can be reduced and splinted in the emergency itself, and the child can go home. Sometimes there can be elbow fractures, which require either a plaster or a small surgical procedure where we reduce it under anesthesia. In the active population, we often see ankle injuries being the commonest. One of the commonest injuries is an ankle sprain, which I think everybody in their life at some point of time has faced. These can be simple injuries with just a ligament strain, or some of them can even progress on to fractures, as we see in elderly patients who have a twisting injury. And in more elderly, we see the commonest injuries I have seen in my practice is either a hip fracture or a spine fracture. Again, the treatment will depend upon the grade of the injury, the severity of the injury, and the functional requirement of the patient.
Namaste, my name is Dr. Vishnu Vijayaraghavan, and I'm a consultant orthopedic surgeon who has been working in Sundaram Medical Foundation, Dr. Rangarajan Memorial Hospital for the last 6 years. I think in today's day and age, a lot of people are using cell phones and laptops on a regular basis. Most people tend to keep their laptops a bit below eye level, and that tends to make them reach forward and peek down, which tends to lead to neck pain and postural issues in the lower back. My advice to everyone who has such problems would be to keep their laptop at eye level, maybe pile it up on some books to make sure that they're looking straight and not looking down. This helps to improve both your neck posture and your back posture. The second would be to have adequate seating, which proper back support, as well as while using cell phones, not to keep it to one side, maybe put the call on speaker or use wireless headphones. In orthopedic surgery, we primarily use metals. I think it depends on the grade of metal that you are using in the body. You do get certain different grades of metals. Here at Sundaram Medical Foundation, we use only the best imported implants for our patients to ensure that the plate can be put on the bone and it can stay with you for life.